And so we are working with this site. And what we're actually looking at is how internal migrants move from different places within South Africa coming into Johannesburg, but also young people who are moving from international borders, that is Zambia, Zimbabwe, Mozambique, wherever they could be moving from. Okay. So I'm trying to move my slide here. Okay. There we go. Now, just a little brief background on young people and them moving. We know that, so why are we actually interested that these young people are moving? Yesterday, if we were listening, we heard that people move when they are healthy. And if you think about it, you're healthier when you're younger, right? I don't know how old people in this room are, but I'm 40. And when I was 18, I was more energetic than the way I am now. I have 2 kids. And before I had those kids, my body felt, I don't know, stronger. So now we know that young people make up a bigger population of the people who are moving. We know that everybody's moving for whatever reasons. I mean, 40-year-olds move, 50-year-olds move. But what we are seeing is a lot of young people are moving. And they're driven by different things, like we discussed yesterday. Does anybody remember what we spoke about and why people are actually moving? I want us to discuss. Does anybody remember what we spoke about yesterday and why people want to move to different places? Okay, their names that I see. Melissa. Let's talk about it. Let's talk. We spoke about this yesterday. Why are people actually moving? Why are people interested in moving? Why do you think young people want to move?
Okay. I think we mentioned something along the lines of people moving because they can't find the resources that they need in their own countries, and their needs cannot be satisfied in those countries. Hence, they move for better opportunities and greener pastures. Yes.
Awesome. Why do people move? Do we have any migrants in this class? Do we have migrants? So why did you guys move? How many of us here come from Johannesburg? How many of us come from Johannesburg? Okay, this is actually very interesting. So everybody in this room actually doesn't come from Johannesburg. Who comes from Limpopo? There we go. So why did you move, or why are you here? Why did you move from Limpopo? Whether it's been 2 weeks, whether it's been a month, whether it's been, I don't know, 5 years, why did you move?
To be better capacitated in knowledge on migration.
Okay.
And for the 4-star hotel.
Okay.
And sparkling water.
So he moved for a luxurious life, I guess. Yes. Okay. Somebody else? Who's from KZN? Who's from Eastern Cape?
KZN.
Oh, and why did you move from KZN?
You mean me from online?
Yeah, and
okay. Sorry, we didn't get that.
okay, I moved for opportunities first, and then second, I moved for betterment because I come from the rural areas.
Great. Okay. Who's from the Eastern Cape? Oh. Okay. Just give me a second. Who's from the Eastern Cape? Okay, let's go to the hand online. Do you want to tell us why you've moved? You can write it down because we are also monitoring the chat. We have? Okay, once more, go ahead.
So, I mean, I think that one of the reasons would be, for me, I think of it this way, perceived economic opportunities. And I say perceived because after you move, sometimes you realize actually those opportunities you thought they were there, they are not there, or they deplete, they finish maybe after a year or less than that. So I would call it perceived economic opportunities.
Okay, that's very interesting. Thank you for that once more. Perceived economic opportunities. Something that's actually interesting about moving, that I think we've read about in literature, is that the first 3 months when you move, those are like your, I don't know, difficult, adjusting. Let's see if I'm going to stay. Let's see what we're going to do, all that, right? I want to know who has moved from Mozambique to Johannesburg. Botswana, Malawi, Zimbabwe. Okay, why have you moved from Zimbabwe to Johannesburg? Lelo, go ahead.
I moved to study,
You-
to study.
Okay, so educational purposes. Do we have Malawi, Kenya, Zambia, Nigeria? Yes, Tola, why did you move?
I'll say family reunification. I moved to join my husband.
Okay. All right. Anywhere in Europe? Who's moved from Europe to Johannesburg? No? Okay. Please, yes.
Now, is it mobility or is it migration?
Mhm.
Because moved, it's done.
Yes.
Like the colleague from Messina, like, has he moved? Or is it that transfer, just come and go?
Yeah.
So that would be an interesting question.
So I guess my question in our study in particular, we want to look at people's mobility. Because the other thing that we know through literature is that people who are mobile seem not to be in one place, you know, consistently for whatever period of time. They keep,
Yeah.
you know, this whole mobile. So one time they're here, they may decide to be, Lelo said she came here to study, but every 6 months, maybe she goes back to Zimbabwe. There were people from Limpopo. Maybe every 2 weeks or every 3 months, they go back. You know, that sort of mobility. And what does that mobility mean for healthcare access for these people, right? So that's what we want to look at. So now we also know that migration limits mobile adolescents, young people's access to health services, including that of sexual and reproductive health rights. So something that we're actually interested in looking at is the reproductive health of young people. We know that young people who are moving, and the ones that we are looking at in our study, in the age group of 15 and 35, are at their reproductive age. And while they're moving, we are saying they're struggling to access health services, right? I want to know if people in this room who have been moving, have struggled to access health services? Or know of someone who has struggled to access health services? Anybody? Yes, go ahead. Tell us about that.
All right, maybe it's also a second introduction of myself. I'm a change agent for Future Families, working in an IOM project called Sexual Reproductive Health Rights. So that's my core job in Limpopo. And we have young girls from the age of 12. When they access the clinics, since primary healthcare is free, with a passport, sometimes they're turned away to go to the hospital where they're expected to pay some fee, which is also illegal or not supposed to be that way. And those without documentation, also it's a struggle. They are turned away either for coming late. If they come to register, maybe when the pregnancy is 3 months, they'll ask them, where were you the past 3 months? So go wherever you're coming from. So these are things that happen right in front of our eyes. It's not somebody telling a story. And the last story I recorded was a young lady who I further referred to the manager with our referral letter because it's got some kind of, level of respect there. But she's hesitated to go and say now she's not sure if she goes through the manager and what kind of service she will receive, if she's going to be safe, if the nurse who turned her away sees her there coming from the manager. So there's a lot of, once I do not get service here, if anybody advocates for me, it's going to be maybe a risk to be served by the same person who turned me away. I wouldn't know if they'll inject me something dangerous or give me something that will, harm me in the end of the day. So there are a lot of struggles in that category of sexual reproductive health. Thank you.
Thank you for that. So we know so many stories that Tifo is talking about, right? We've heard, we've read, there's so many people who've actually written about this. This is why it's important, I think, for us to look at these issues. And because of this, we are seeing poor health outcomes for these young people. But we know that when they travel, they are healthy. We spoke about this yesterday, right? When this 25-year-old Langa comes into Joburg, she is healthy, she is ready to get into the workforce, or if she's coming for education, but because she's in this environment, she's going through these difficulties in accessing healthcare, it becomes a challenge. Her health begins to deteriorate, right? This is why we are interested in these issues. Now, we spoke a bit about health, and I think Siraj is the one who gave us the definition of what health is yesterday. Do we want to talk about that? And do we want to talk about well-being? Anybody? Yes, go ahead.
I think on that definition, I know perhaps occupational covers what I'm about to say, but I was going to say environmental as well, as one of the features that we can use to determine whether someone has access to well-being. Because I think increasingly there are other sort of issues that make life uncomfortable for people, such as pollution and environmental degradation. So I think it's probably important to consider that as one of the key factors that we use.
Okay. Yes, sir.
What I also mentioned yesterday was that somehow we think health is a thing that we can measure being black and white. If you look at the definition of well-being and also the definition of health a bit more clearly, it's a subjective measure. When I say, if you take well-being, refers to state of being comfortable and healthy and happy. I mean, I can be happy when I'm misery. Doesn't mean that another person will be happy when they are in the misery.
Yeah.
This is also, like we have discussed this with Lorraine and others, the concept of salutogenesis. It's about how you understand your context and what do you think that makes sense. For a poor family, having food 3 times a day, they're extremely happy. For a middle class family, no, that's not enough. We don't have electricity, we don't have internet. So that's a subject. So I think it might be good to have that in mind. It's not an absolute measure.
Yeah.
Even though we would like to think so, it's not. So just want to make that point.
Yeah. Exactly. Miss Becky.
Thanks, Langa. I always find these definitions really interesting in that that they're so aspirational. I mean, I don't know anybody who would claim to have achieved these kind of states. And I also, yeah, for me, it's even when we talk about happiness, I mean, it's rare that people say I'm happy, right? I mean, sadly, but I think part of it is about having the tools in place to access health or the tools in place to access well-being. So if those are in place, for me, that's like, you know, if I have a way of being healthy or trying to be healthy, that's fine. But to claim a complete state of either health or well-being for me is kind of high in the sky, really.
Yeah. Yeah. Anybody else thinking around health and well-being and what it means? Are you guys healthy? Are you? Because, you know, the
Sorry.
more I think about health, like this definition for me as well, I feel, can I actually get to a place where I am set to be healthy? Because some way, somehow, there's always that little something that bothers me. And, so it's disturbing my mental well-being. And I think in the world that we live in, if you Googled right now and, you talk about mental well-being, it almost sounds like you can't even achieve it. I don't know if you can. Do you guys think you can? Can you actually get to a place where you say, wow, I've achieved, this state of health? It's okay to say yeah. If this is how you feel, it's okay. It's a discussion. Yes.
For me, I think what remains important is how individuals consider what is important to them relating to health and the degree to which they feel things need to change in their lives. That, for me, puts health in a perspective that's more realistic for me. Whatever I'm feeling, however I'm doing, the degree to which I feel this needs to change defines my state of health and well-being.
Yeah. Yeah. Anybody else? Yes, Becky.
Unless there's anyone else, I don't want to take over. But similar, I think it's, for me, like when you were saying about, it being an age-related thing, right? And about young being healthier. And I actually thought to myself, actually, I think I am healthier or at least fitter than I was pre-kids. Because now when I have a chance to exercise, I value that space. And I can do way more burpees than I used to be able to do because that my life situation has changed and so it becomes circumstantial. So as you were saying, what I prioritize right now is being healthy enough, to be there for the kids or, to feel like I can multitask or whatever. So I think whatever stage you're at in life, it is around sort of that the context in which you're in at that moment. And again, what is achievable in that moment. But I think that's why I find that division between mental health and physical health so interesting because so much of it is just your state of mind.
Yeah.
Right.
Yeah. Yeah. Anybody else with thoughts? Go ahead.
Sorry to jump in from online. I've been raising my hand. So I was going to say then, it's interesting that if we think of it in this manner, then we say, for example, that actually health is kind of a part of well-being in a way. And if that's the case, or even if not, the well-being is subjective, as the way that's being spoken about in the room. Which then, if that's what we could say, then it becomes difficult to study the health and well-being, thinking in a manner that we can measure it as if there is a way to measure it, yet it is subjective. So otherwise, then we can only understand health and well-being from the person that we are talking to and asking them questions around how they view themselves, around how they understand themselves.
Thanks once more. But maybe that is the way we should view it. Because if you think about it, what makes you happy as once more does not necessarily make Langa happy, right? So, I mean, just looking at this definition of well-being, maybe money makes me happy, but maybe food makes you happy. And you're well. When you have food, you've sort of gotten to this place of, well-being, right? As I think Zibu Siso wants to say something.
And I was saying, I think it's possible to be healthy as long as you have money. I'm joking. I, I'm joking.
Yes, Zibu.
I think it's all about choosing your battles, knowing what makes you happy and, concentrating on it and ignoring the other noise, I think.
Okay. Yeah. Yeah. Zibu says it's just about choosing your battles, Money makes him happy, and maybe that's happiness for him, and that's some state of well-being, right? But anyway, when we think about mobile young people's experiences, we know that as they move, they experience a lot of anxiety. I don't know if you guys, when you move, when you go to places. I remember the first time. So I studied at the University of Basel, and I remember the first time I had to go there. I was so anxious, and the first 2 weeks, I thought I was getting into depression because I was all alone, but it, I think I had everything I needed, right? Now, when we think about mobile people or mobile young people moving from Zimbabwe unaccompanied, a 17-year-old has to leave Zimbabwe, whichever part of Zimbabwe, cross the border alone. Whatever issues happen in between, imagine their well-being. What does that mean when you think about their well-being? Imagine somebody, she said she moved from KZN, right? And she said she lived in a rural community, right? Tell us about the feeling of moving to a big city like Johannesburg, the first time you came to Joburg. What was going on in your mind? If you don't mind sharing.
Okay, it was chaotic, but I think I've adjusted because I've been here since 2016.
Okay.
So yeah.
Yeah. But imagine the first time she had to move, right? Maybe for her, she had support structures, but think about young people who have to move and they have no support structures, right? They know that they need to get to Joburg. Maybe they have 500 rands in their wallet and they need to get there and somehow find a job. Because I only want to imagine where you're from when they speak about this big city called Johannesburg, and it's great, it's happening, the vibe that comes with it. But when you go there, I think somebody online spoke about this, the perceived, this thought that you have that it's going to be happening when I get to Joburg. Almost like you get to this place and you go to this place and somebody offers you a job, you start working, and it's all happening. But we know those are not the realities of people who move, or people who are mobile, right? Somebody talked about, the environment, and how it affects, this whole process of being mobile. Now, in our work, what we're really trying to do is also trying to understand young people moving using the candidacy framework, right? Has anybody heard of this framework? I think it's an interesting framework, really, because this framework somehow says how individuals perceive their eligibility for healthcare services and how this influences their engagement with those services. It emphasizes that accessing healthcare is not simply a matter of need, but also a process where individuals negotiate their eligibility with healthcare systems. Right? I want you to think about that. So this individual needs to access. So we're talking about these young mobile people who are moving to this big city or Johannesburg in particular, and they need to access services. And we're saying, what happens for them to access services? It's not only about, thinking about, oh, there's a clinic there. Let me go to the clinic. Lots of things are at play. And this candidacy framework helps us unpack that lots of things are at play before this individual actually gets to access. I think Tifu spoke about how sometimes you have young people and they want to access healthcare services, but maybe they have people around them who have spoken about the fact that if you go to that particular clinic, it's disastrous, right? But they've never actually gone to that clinic and experienced this disaster. But because somebody around them has told them that, ooh, that clinic, they don't like people from Limpopo. So if you go there, they only speak Zulu. So you go there, nobody's going to help you. Do you know how to speak Zulu? And then, so now this person is having a conversation and thinking, the only thing I know in Zulu is Sawona. If I go there, what's going to happen? Right? So that's what the candidacy framework is trying to unpack, that the person is within a context of so many things that are at interplay that allow them to access health services or not. It also speaks about the health system itself. So you've heard that the nurses at Clinic X, they don't want foreign nationals. You've heard this, And remember, when people move, they sort of find networks, right, in this new environment. And this is how they survive, through these networks. So they get into this network and they've heard that, no. Health care nurses or people who assist people at Clinic X, they don't particularly like people from Mozambique. Are they likely to access these services? No. But I also want you to understand something interesting about the candidacy framework. It's not looking at only the health system, right? But it's looking at the person who is mobile and how they perceive these different elements to accessing health services. If you look at my slide, it's showing you these 7 what do we call them, strategies in which the individual would choose to access services or not to access these services. I think I'm not going to go through each stage, but I think I've spoken about some of them. How, self-identification, how you identify yourself, right? Maybe you're saying, I'm from Zim. I don't think I should be going there, or I'm undocumented. What does it mean for me to go there? Or I've heard that, services are not really given to Mozambican people or to Kenyan people or to people from the Northwest there, or the nurses there want only people or prefer people who speak a certain language. All these things are at interplay. And so this is the framework we are trying to use to sort of understand how the decisions young people make in accessing sexual and reproductive health services. So our study has about 4 aims, but I thought I should really speak to these two because they speak to the scoping review that we have just completed. And I know on Friday, I think on Friday, we are going to be speaking about scoping reviews and how to do scoping reviews, which I think is a very interesting skill that every person, whether you want to be in academia or whatever space, should have in trying to gather evidence about a particular topic. We're all here interested in migration and health, and so this is what we would talk about. So the aim of our study really is to conduct policy relevant research to enhance mobile adolescent and young people's resilience to navigate access to sexual and reproductive health services, thereby contributing to their improved health and well-being. Remember, we spoke about these two concepts of health and well-being. Now, we're saying these young people, as they are moving, we've been talking about that, the difficulty in, trying to access certain services. So we want to find out, okay, what are the difficulties? What are the challenges that these young people are experiencing? Now, the second part, it's this concept that I want to talk about of core development, right? The second aim of our project is to co-develop and lead a program or an intervention with young people, which enhances their resilience, visibility, and solidarity, as well as informs policy and practice. We always know that there's, there's this huge gap in policy and practice, but that's what we want to try and do. Now, just a little bit on core development. So a lot of the time we as researchers or students, we go into the field, we collect data, and we think we know what participants or communities rather need, right? Have you ever felt, once you go to the field and you collect certain data and you're thinking, okay, I've collected this data. What does this data mean? Actually, I think these communities need A, B, C, D. Do you guys ever feel like that? Like you have like the answers to the communities, and like no communities. She was telling me yesterday she's looking at nutrition, right? Nutrition and mobile people, and she's collecting data, I think in the north of Johannesburg. And imagine you collect this data and you analyze this data and you're like, actually, you guys need this. Don't we normally feel like that as researchers? Let's talk about that a little bit. Somebody wants to share? Anybody? When you collect data and you think, I know what these communities need. Anybody? Yeah, go ahead.
Yeah, hello everyone, morning. So yeah, I've just been collecting my data in Johannesburg North in this informal settlement, that side, Sawa. So now you're collecting your data and I'm looking at migrants and how they are experiencing the food environment and how South African policies are shaping their food and nutrition. So now yeah, my question here is quite long because it's looking at their food security. I'm using two tools. Then I'm also looking at their diet data, the quality questionnaire as well. So it's quite long, but then from all this, now you're asking them from each and every household. So far I have 350, I've collected from 358 households. So we are asking questions, you are getting the whole picture, you are seeing how they are living. Now, as a nutritionist and from my background from nutrition, you actually identified, okay, so these people are lacking these things. Yes, they are saying they are here, at least they have jobs, things are cheap here, at least now they eat meat. But now when you ask, okay, so what did you eat yesterday? Yesterday, did you eat meat? Their answer is yes, yesterday we ate meat. What kind of meat do you eat? Now they are talking about chicken feet, they are talking about chicken dust. And then when you try to sync all that with the knowledge that you have, you see that it's not healthy. It's not the kind of protein that that really works for their health, that helps them. Like when you look at their dietary quality, as much as they are saying, okay, we also eat protein, but it's not the kind of protein that they are supposed to be having. So like what Dr. Langa has been saying, you look at all that and you actually have answers, and you to be like, oh, if only I had money, I would know exactly what they need. Yes, they have this, they have money, but they don't really know what it is that they are supposed to be using it for. Now you think, okay, maybe if there's any NGO that comes, or maybe government, if government wants to intervene with all this data, then yeah, they will say, okay, they have this, the shops are there, the money they have, or maybe they have more carbohydrates. Now when they come, they need to come with all these other nutrients for their nutritional health. So that's the whole thing that you get from the data that you're getting. I think I have answers, but then there's always that issue with policy and practice. There's that gap that needs to be answered.
Yeah. And just just the complexity of, life itself, right? You go into the field, you're collecting data, you're answering, your respondents or your participants rather are answering, these questions, these survey questions, and you suddenly think, oh, bam, I've got the answer. Listen.
So I don't think there's anything wrong with having the answer or thinking that you have the answer. The question is, what do you then do going forward? So I think this ties in with a lot of what's been spoken about in the space about extraction and co-development and involving the community that you're actually working with, right? Because I may have the answers, but you know your context better. Sometimes you know why you're doing things in a certain way. Yeah. So for me, it would be, how do I use the data that I have collected and my expertise? Because you can't run away from that, right? Especially like what she's talking about with the nutrition. Like there are certain facts that exist. And I can see that, you guys are kind of deficient in A, B, C, D. So can we sit down and I guess discuss why you're doing things the way that you're doing them? I bring in my 2 cents. What can we co-develop so that you guys are happy with the solution and you don't feel like, for example, the chicken feet. You don't feel like I'm coming to say, oh no, don't eat your chicken feet. You need to eat A, B, C, D. You can have your chicken feet, fine. But where else can we make improvements into what you are doing so that you have better outcomes?
I like that. The idea of co-development. Yes. So the ideas that should come together are not your thoughts, because you rightfully said you could be an expert in this field of nutrition, but there's so many other issues that are at play that you need to always be involving the people in who are part of who you want to have a solution for, right? You wanted to say something.
Okay, so I'm finalizing a paper on the day laborers, like those that stand by the robot for employment. So I would go there collecting data, asking them like, how is it? Are you guys getting jobs? How often do you get jobs? Do you have the work permit and stuff like that? So at least I'm collecting data, I'll be thinking at the back of my mind, how am I going to help these people? I have the solution. Can I open a compound for them so that they cannot, stand in the heat? Or you know, just look for something else that can help them feel better, maybe look for a job. So like those kind of solutions, sometimes you have the solutions, but the people, they are undocumented, the people, you can't really help them. Even if you write a paper, you recommend and stuff like that, but they need to document themselves first and stuff like that. So yeah, these are some kind of information that should be.
I think what you're talking about is really interesting. And I think Joe spoke about this a little bit yesterday, where she was mentioning how did she put it? How, you know, you want, there's a term, there's a word that she used, you know, being almost like in the background, being silent, but doing something. Do you remember that conversation? And then there's people who are in spaces who are, you know, out there and they're able to have these solutions. But you're sort of in the background, but you know, you don't think the work you're doing is enough. You almost feel like, okay, we're going to get the PhD, get the papers, get, you know, and it's done, you know. But yeah, thank you for that. Somebody had a hand up the side. Okay, before Becky.
Okay, hi everyone. Yeah, so this takes me back to my master's thesis during data collection. So I did something around syndemic suffering among Nigerian women in Johannesburg. And I conducted my interviews on the phone because it was like lockdown-ish period. And, you know, somehow I saved contacts of my participants and somehow moments later, I mean, they depicted this picture of precarity to me during the interview. Oh, we are suffering, we don't have access to this. We stay in Johannesburg CBD, we don't have food, we don't have this and that. And, you know, I see them like few months later updating status, relocating Canada, America, taking boat trips, Cape Town, Robben Island. And I don't know what to do with that data. And, you know, the picture I had at that point when I was interviewing them was that, oh, my people are really going through, you know, this kind of institutional xenophobia. They lack this and that. And then I don't know if to call that digital ethnography. And I'm seeing on their social media, I know they say people put their best, you know, pictures and all that on social media, but so it's very, I can't reconcile, you know, what they are saying and what I'm seeing.
Yeah, I think that's interesting. It's also really talks to the way, and I always talk to students about this and other researchers about being careful about how you think about other people, you know, and maybe really the conversation also on health and well-being, how we may go around thinking Langa is vulnerable and maybe she's not, you know, and what it means that I am healthy, I am well, you know, just really thinking about those concepts and how we define them and how then when we go and collect our data, what it means in relation to the communities that we go into. Yes, Becky.
I know I'm respondent to this, so I don't want to take up too much time, but this is such a fascinating conversation. And I think, you know, for me, I think there's a real, and I think you're getting at it, the essence is about being honest about what you're trying to get out of this encounter, right?
Yeah.
So if you're going in with, you don't necessarily have the answers, you don't have a way of fixing things for people, that's okay. Just be honest about it, because I think often that's the problem. We go in and we kind of give this impression that, you know, we're going to really see how things can be done. And I think we don't step back enough and just own our own positionality in it. But I think it's also something to learn from the fact that we're never the first person to go into that situation. There's always going to be people who have been involved, who are interlocutors, who have been working at a community level. Like we're very rarely going into an untouched space, as it were. So there's so much merit to kind of learning and listening first and throughout.
Yeah.
And then just one final thing in terms of what Tola was saying, I don't know if we need to reconcile anything, because everybody, whether you're a subject of research or the researcher, a migrant, not a migrant, we all live contradictory lives. You know, we all live healthy, unhealthy, like good lives, bad lives. All of our lives are contradictory. And I think sometimes we expect the people that we're doing research on or with to kind of have answers that we don't have ourselves. So again, I think it's about also recognizing that research is about being in these encounters, but so much of it is about actually just being honest about where we're coming from and other people are coming from.
I think that's very interesting. Yes.
Could also just add that along the lines of what Becky said, somehow we are trying to find the truths and there is no one truth. So your participants, what they put on online, social media, that's part of their life. What they told you is also part of their life. So maybe in our writing and research question, we should not say like, this is how it is for them. No, but this is how it's for them in parts. And I mean, you're sort of concerned like, this is what they told you over the phone and this is what is on social media. But even when you have direct conversation, there is also known as this social desirability. When you ask questions, because you're a researcher, let's say you work in nutrition or whatever that might be, they would like to say good answers. Or if there's research who is trying to look at the challenge in access in healthcare, they might like to exaggerate the challenges they have or may not have. So you can never know unless you have a polygraph test. You can never know if they're telling the truth or not. But again, the thing is that we were having the discussion yesterday with somebody saying, "Oh, it's so cold," and I said, "Yeah, that's subjective to you. For me, it's warm because where I come from." So I don't like. I think when research, two things is we really need to know the limitations of what the research is and be honest about it. And whenever I read a conclusion or recommendations of any paper or any report, I think I said it's far reaching than what the data actually allows us to say. I think we really need to hold back and read through. Do I have enough material in my results to actually say this, what I'm saying? For that, you also need to take a step back. Did I choose the appropriate method to answer my research question to get the right result to write this conclusion? Then it's fine. Because we all are biased, participants, us, and all. So we are only giving one side of the picture, and that's fine. Because there has to be other researchers sort of seeing it from different perspectives. Because say you're a woman asking questions to another woman, right? A man asking the same question, that woman might get different answers. It doesn't mean what they told you is lie, but that's an interaction. It's that happens then and there. As long as we are recognizing it and acknowledging it, and that's how we present the results and discussion, I think we are fine.
Yeah. Yeah. Thank you for that.
There's a comment online. That's what
Okay.
I was trying to tell you.
Yes.
Sizwe says the healthcare system is full of examples of participants being overlooked. One example that comes to mind is when doctors in public hospitals have a discussion about a patient without even talking to them.
Oh, wow. Did you guys hear that? Becky, please say that again.
Sorry. There's a comment online from Sizwe who says the healthcare system is full of examples of participants being overlooked. One example that comes to mind is when doctors in public hospitals have a discussion about a patient without even talking to them.
That is really interesting. How we right now are having a discussion, from a researcher perspective. But if you think about it, the doctor is literally supposed to be having a conversation, this co-development that we're talking about, right, Shami? So Shami spoke about that. And that's actually the point that I wanted to end with, to just say, what our work really wants to do is to have conversations with these young people, and I think that's what's important, to come up with solutions for them. I remember when I had my first daughter, and my pediatrician said to me, "Langa, do you know what? You you are the best doctor for your daughter. Like you know everything about her. When you come to me, you're literally going to tell me everything about her, but you actually have most of the solutions for her, you know. And I think that really speaks to Caesar's point. And so the idea of co-developing is to say, let's sit down and hear what your challenges are, what the barriers are, what you think we can do to make this work, right? Because I can come as a researcher and think, oh no, this is what's important for young people. This is what's important for these young people. But maybe it's not. So, you know, one of the things that we're really keen on doing in our work is to sit down with young people and have those conversations with these young people. I don't know how good we're doing on time.
I think since today's program's kind of
Oh, okay.
out, I think we're fine.
Okay.
And we also started late. So
Okay.
I think, yeah, just
All right.
get to where you need to get to.
Okay. So now we're using different methods in our study, like most of you have been talking about the different methods that you have been using in your own research. And like I said, what is big for us really is the co-development of this program that can work for young people. So we're also interested in seeing because remember at the beginning, I told you that we are collecting data in different sites. So in KZN, in Johannesburg, in Lusaka, in Livingston, and all that, we're interested in seeing the differences, you know, because what we also want to bring out in the work is that mobile young people are context specific. So people are different everywhere. And so their needs in different places are going to be different, right? But now today, what I actually want to share with you guys is on the desk review that we did, particularly the scoping review. So we spent, quite a number of months. I can't remember how many, doing this scoping review. And I was talking about a scoping review, and we're going to talk about it as well on Friday. How I think it's really a way of gathering data or scoping through literature that is a good skill that people should have, you know. It gets daunting sometimes to screen. I don't know, has anybody in this room conducted a scoping review? Tell me about the experience. Tell me about the experience, Melissa. Yeah.
So as part of the GEMS team, we conducted a scoping review on gender-based violence among African migrants in Africa. At first, I'm not gonna lie, it was excruciating because it was my first time actually conducting a scoping review. There were a lot of mistakes. You run a search string, it highlights a lot of errors and time is taking. But eventually, once we got the hang of it, I thought it was actually a very good experience.
Yeah.
And also it actually informed why I'm planning to not really conduct a scoping review, or not that I'm conducting a scoping review for my research, but to actually develop a search string to find what has been actually, you know, published around my area and the type of articles that I can actually include in my literature review. So as much as I'm not using the scoping review, I think at the end of the day, it actually helped me, not only for the JUMPS work, but also for my work. Yeah, thanks.
Exactly. You know, so it literally gives you what's out there, right? On your topic. Somebody else wanted to talk about their scoping review. Tanatswa?
More or less the same. We did the scoping first, but then I diverted into a systematic review. But it's more or less the lessons. What was my biggest takeaway from it is you gain a lot of hands-on skills that you can use anyway, but the discipline with which it teaches you to approach literature review was quite amazing for me. Excruciating, as he said, but just the documenting everything. It's I think the discipline for me, like you have to sit with it, no matter how long it takes. Imagine reading 800 articles, the title and abstract screening. That's a lot.
Yeah.
But you have no choice. And even if it's the both of you, you have to like validate what you are looking at. So
Yeah.
it teaches you a lot of discipline, like no shortcuts, which I think for research is very important.
Yeah. Thanks for that. I saw one small comment saying it was a flop. What happened once more? Can you tell us about that?
It was, so I was doing it with some my former students, and it was I was just testing the method because I had never done it in any other setting. So I was just experimenting, trying to make use of it. But yeah, it didn't go well at all. I think that I didn't have the necessary knowledge and skills to actually do it. And as Donato and Melissa say, like the big number of articles were kind of a scare for me. But still, we tried to do something, and we did have kind of a complete project, which was never published because it wasn't really good. But I think one biggest challenge was how do we produce a journal article from a scoping review, because I'm very used to writing papers using empirical data, which then kind of easily tells me what section should have what. Like if we say an introduction and then a literature review, that's more of literature work. And then the methods and then the findings, then that's like where I come in as a researcher a lot more to speak about my current work, and then the discussion mixing, combining the literature and my current study. So I think that's where actually the biggest challenge was to decide what goes where when I had done a scoping review, because everything is a literature.
Okay, thank you for sharing. I think you definitely need to be there for the session on Friday, because we will be talking about scoping reviews. But just to share what we did in our scoping review. So what we wanted to do is really find out what sexual reproductive health rights interventions for mobile young people have been implemented in sub-Saharan Africa, right? And then we also wanted to know the factors that have impacted the implementation and the effectiveness of these interventions. And then what we really needed to know, the wider lessons. Because remember, I told you we are going to be co-developing or co-designing an intervention or a program. We wanted to see what was out there. Like Tanatswa and Melissa, it was excruciating. It's always excruciating, but it's an excruciating in a nice way. I don't know whether that makes sense, right? Where you actually are going through so much literature. You're going through abstract, but what it does is it feeds into your work, right? So you've read, our records were 1,644, right? And we screened, how many did we screen? Full text, 368. That's a lot of articles that we screened. Imagine reading 368 papers. So yeah, that it gets really excruciating, but I think it's excruciating in a nice way, because it's really feeding into the work that you're going to do, right? So you have this idea now when you go in, and collect your data, oh, remember we read this article about so and so in this context. Could it be the same? That's sort of what you begin to see. Now, just a little bit on the findings. Imagine after the worst part, I don't know whether it's called the worst part, but after screening so much, we only got 25 articles. How interesting is that? But I think that's what the work is supposed to do, right? And so the thing about it is you're looking for certain things. This is why, you start off so big and then it gets so small, because you're looking at specific things in the extraction process, right? And in terms of locations, so we looked at sub-Saharan Africa, but in the inclusion criteria, what we found, we only got in terms of locations, 12 articles that were from Uganda, 4 from South Africa, and 4 from Ethiopia. And in terms of the target groups, we had 10 articles that had the age groups of 10 to 19 and 15 from 15 to 35. And looking at the focus areas, 15 of these articles looked at all genders, and 9 focused on women alone, and only 1 focused on men. In terms of the sexual reproductive health services, most of these articles spoke about HIV. And 1 spoke about pregnancy and 1 about contraception. Then maybe just, the 2 interventions that these articles, spoke to were mainly linking participants to service provision and also not the knowledge and information skills. But the other broader themes that our paper looks at are implementation facilitators and implementation barriers. The reason why we thought this was important, at least for us, was if we're thinking about co-developing, what does it mean for us to have a successful program? And what was clear, I don't want to present these other slides because I think we need to go for tea now. Okay. This is just a summary of the 2 interventions that the article spoke about. But in terms of, implementation facilitators, what we saw was that all of these articles were using community people. So it was peer navigators, it was health promoters, it was mentors. And this is, the conversation that we're having earlier on about the involvement of community. So if you want these sort of interventions to work, or this co-development to work, you've got to be involving community people. And just that last point that I have on the slide was that what was key in these articles was that there was use of participant-centered ways of doing things, right? And it was peer-driven because we were basically looking at mobile young people. It was peer-driven. So for example, for young people to access these HIV testing centers, young people needed to talk to them about it. And also what was really interesting was they often used creative methods. So if it wasn't role playing, drama, comic books, to get, these young people involved. And now, in terms of the barriers or the challenges of implementing these interventions, this was the list that we had: issues relating to culture, stigma, people being mobile. So some of the articles spoke about, I think what Suraj was speaking about earlier, that, mobility, what is mobility? So people can move into a place for 2 weeks, for, a short period of time. So that made implementation really difficult for some of the articles that were there. I think we've really discussed everything that I wanted us to talk about today. But just, thinking about the different issues when doing our own research, as I was sharing the research that we are currently conducting, that well-grounded theoretical informed intervention models are needed to address social, cultural, and religious factors connected to mobile young people and their reproductive health needs. And I think it's important to think about that and think about the processes that occur when people move, that it's not as simple as young people have moved or your participants that you're looking at have moved and that's it. There's many within the process, there's so many things that are at play that we need to think about, when conducting our research and trying to come up with or co-developing solutions with our participants. With that, I thank you guys for your time.
Thank you so much, Langa. That was absolutely fascinating. And I think from the level of participation, you can see how much people really engaged. I'm going to just give a very few little responses, but I know we should break now for tea so that everyone can sort of get up and wiggle around a bit. And I'm thinking maybe what we can do is over tea, just have a think about anything that you would like to ask Langa or ask anybody else in the room. And then when we come back, we can kind of continue the conversation. So I just have a couple of things. Well, I have a lot of things, but I will try and keep them to a few. So the one is, I was thinking throughout when we're talking about youth or young people on the move, is often, even though we talk about being mobile and on the move, often what we're looking at is actually moments of stagnation or moments of being still or stuck. So I was thinking about some work I did with Save the Children around for girls on the move. And, the experiences that were shared with me were very much those experiences were those moments when young people were not moving. Perhaps within the journey of, getting from A to B, but it was those moments when they got off the bus and they were stuck at a bus station and the number they'd been given to call a family member didn't work. And there was that, what now? Or the moment they're in the back of the truck and IDs are being checked and they're trying to hide. So I think it's really interesting that when we focus on mobility or migration and think about how, we always frame things in terms of being on the move, so much of that, particularly when it comes to forced migration, is about being stuck. Or being in these kind of moments of non-movement, if that's a word. And then the other thing I thought of, and this is going to sound very, I'm going to sound very much like a Cape Town person who sits on a beach, eating sushi. But it's around theory I was reading around motherhood, and it's about this idea of rupture and repair. And I bring it up because, when we're talking about young people on the move and particularly difficult situations in migration, we're often thinking about disruption or like moments of dysfunction or when things aren't working or happening as they should. And, the idea of rupture and repair with motherhood or parenting is that, you know, children, it's fine for children to experience rupture in their lives as long as they experience the repair that comes afterwards. And so that they learn that it's, you know, we all go through difficult times, but the things do get better. And it's an important learning curve, not just for children, but for everybody, that there is that repair that comes after rupture. And I think, you know, a lot of the very difficult stories we hear about, particularly young people who are on the move, is that it becomes rupture after rupture after rupture, and there's no space or time for the repair work. And that's not specifically just young people on the move, but I think particularly when, you know, you're looking at, for example, a young person who's coming from the DRC, who is, you know, has not, I'm thinking particularly of a young 11-year-old girl I was talking to in Joburg, who fled with her sister from the DRC after her parents had been killed, came to Joburg, no passport, nothing, because nobody had advised them to bring their documentation with them, which is very different to a lot of other young people on the move who are quite savvy and like in touch around what to do, who to connect with, what to bring. So there's those distinctions. But, you know, for her, it was this continuous rupture, because she gets to Joburg and then she doesn't, you know, because she doesn't have the documents, she didn't know that to apply for asylum. So, you know, eventually found her grandmother, but now she can't go to school. So it's, although it sounds like in a way, you know, we're victimizing young people, I think sometimes just looking at the realities of these ruptured lives, it really is that there aren't those moments of repair happening. And I think that's a really important thing to maybe think about. And then finally, just that, you know, the point around the diversity of young people or young migrants. Also, if it makes us think about the definitional issues that constitute childhood or youth. And I know this is a much research discussed issue, but I think it continues to be at the forefront, because when we talk about young people and we talk about children in particular, it has particular perceived vulnerabilities and perceived capabilities. And I think we still very much fit within that framework, and we struggle to move beyond that. And I think particularly for the kind of youth that you were working with, like adolescents, that's a very difficult space to occupy. And we see it when it comes up with like issues around sexual reproductive health and consent and you know, all of those issues where are you a child, aren't you a child? And how is that defined? So I'm going to leave it there. But can we just say thank you to Langa again for such a fascinating discussion. And we'll come back after tea and with any questions, and also to the people online, if you would like to post your questions in the chat, or we will come to you after our tea break. We will come back together again it's 10:39. So it's 20 minutes if we come back together at 11? Yeah. Okay, cool. Thanks, everyone.